record this. Recording and on Facebook. I didn't get a notification though that we got Facebook. Oh, we are. Hello, everyone. We are live. It's always a little fun around here to get the Facebook Live. I'm Dr. Jennifer Gardella, and I am here with the lovely Kim Permar. Got to get that name correct. I don't think we've congratulated you here on our weekly Facebook Lives, Kim. So congratulations on your nuptials.
Thank you very much.
Kim is the executive director of BCHIP. They do great work in ensuring health equity and health education and awareness in Bucks County. So, Kim, how are you today?
I'm good, thank you. Feels good to be a little more settled after a nice long holiday weekend, so it's good.
Awesome. So, we're going to talk about immunizations. You have some big news. We have new funding. Who doesn't love new funding for programs?
We do. So, there's always changes, and we've had some grants that were funding some of this work previously, but they've been winding down. And so we're really happy that some of our private donors are stepping up. So CNN Bank here in Bucks County is stepping up to help fund our immunization program. And then the Foundation Community Partnership here in Bucks County also have stepped up to help us with immunization clinics in our school districts. And there's really good reason for that. We're finding kids that are not immunized, the rates of kids that are not immunized are increasing over the last 5 years. So we were looking at some data not too long ago, and when we look at our seventh graders or our 12th graders, the rates are still okay. But a lot of folks lost confidence in vaccines, sadly, because of the COVID pandemic. And so it seems like more younger families are not choosing to vaccinate their kids or not sticking with the vaccination schedules. And so then kids can't go to school and because it is required unless they have a legitimate opt out. And so it's just getting messy. So we'll talk more about that. But yes, I'm excited that we were able to get this funding so that we can sustain this program. And actually, we're growing it, we're expanding it. So we'll be providing vaccine clinics in 5 of the school districts this year in Bucks County.
Yeah, so let's talk a little bit more about the data that you have. So, what are the rates of, you said something to me earlier about influenza rates? And was that in younger kids?
So we just saw some information that came out that was shared, and I'll do my very best to quote it specifically. I don't have it pulled up for today's interview, but the data that I saw said that we had 246 kids across the country die directly related to the flu last year from last year's flu season. And that is more than any other year since we've been recording flu deaths prior to the year 2000. So that just really shook me. Like 280, over 80% of the kids who died from the flu were not vaccinated
Right.
and were eligible to be vaccinated. Some kids have other underlying conditions or whatever and can't be vaccinated, and that I understand. But of the kids that died, I think it was 89% could have been vaccinated. And that's crazy to me. That's over 200 kids that died in our country from something 100% preventable. Like I just can't wrap my
Yeah.
head around that myself. So we are really committed. Flu is not a required vaccine, but boy, and I don't really believe in using scare tactics to get the community to engage in flu. So I know this is a community forum, but that's not really my goal, is to scare people. I'm not trying to scare people. Um, and I understand the hesitancy that people have around vaccine. I still believe that people who have health conditions that put them at risk should get a COVID vaccine to minimize death rates. But that vaccine did not do what we originally promised in public health it would do, right? We originally thought it would stop the disease, and then we thought it would, absolutely prevent people from getting the disease, and it didn't. And so people have lost faith in vaccine. I think those that work in public health, like myself, we kind of need to own that. I mean, I wasn't part of the vaccine team, I can assure you, but I
Right.
feel, committed or obligated to say that, I understand some people's hesitancy around the COVID vaccine for the general public. And that's a personal decision, and I really don't want to, comment on it either way. People have to do their own research and use their own data, because you can find data sources to support whatever decision you want to make in that world. And so that's up to them to kind of make their own decisions. But the other vaccines, things like measles, for God's sakes, we have kids dying from measles. That just blows my mind. We have polio that's represented itself, in our country. And, gosh, we work with the PA, the Pennsylvania Polio Survivors Network, and it's just so preventable. Vaccines work. The fact that we have kids getting measles because they're not getting their vaccine, because I still can't believe that the doctor who did the research around autism and its connection to vaccines has literally been discredited. He's literally lost his license to practice. There's been hundreds and hundreds of studies since that research. And we still have leadership in our communities questioning whether um, the vaccines can cause autism. It's just crazy to me. So anyway, we are committed to bringing that work out to families, just trying to eliminate all the barriers that we can. So
Yeah.
what are those barriers, right? Transportation, we know is a problem in Bucks County and only about to get worse, sadly, because of some of the changes there. And so we want to bring vaccines to the community where people live. So that's what we're doing. We're bringing them to the schools. One of the other barriers, of course, is payment or
Oh,
copays. And so these grants that we have are helping us cover the fees for any copays associated with these mandated vaccines so that there's no barriers there for families. And if somebody's completely uninsured, we're not advertising it, although I guess I am by talking about it on here, but we're not advertising that we have funds for people that don't have any insurance. But should we get somebody that shows up and doesn't, we have a small pocket of funds that we can use to just say, that's fine, we'll give you a shot anyway.
yeah,
And so
and just to be clear, like you're not walking in and sticking a whole bunch of kids in the arm. Like there's a process also for the parent to have a say, and permission slips will be signed and health insurance information will be exchanged. So this will not be some radical vaccine movement going through the schools.
right.
I think that's really important. I also want to say, Kim, I may shock you with this. I don't know if you know this about me, but I was all for vaccines when my kids were born. I didn't know any better, and then actually turned to the other side. Do you know this? Do you know this story?
No,
Oh, this is a good one to bring up right now. Don't worry. Kim's like, uh-oh, what's Gardella going to say? So my daughter I was hauled into the nurse's office when my daughter started kindergarten, and she had received her varicella vaccine, her chickenpox vaccine, the day before her first birthday. And in New Jersey, you had to receive it on or after your first birthday. So they were demanding that she go back to the pediatrician and get revaccinated. I didn't want to spend my $10 copay for 6 hours, nor did I want to go to the doctor's office because my kids, who I had three daughters under 10, like we were always at the doctor.
I wouldn't want to give her a second vaccine that she didn't need.
Well, according to the state of New Jersey, she did. And if the school had been audited, they could get in some trouble because it was on it was before, not on or after. So I thought about telling this story when you said credible information, went to the internet, and said, how do I get out of this? And went down horrible rabbit holes and what the kicker that you said is credible information. So even though you may not believe what a current administration or a doctor, you need to make sure that you are picking up on credible research. To Kim's point, make sure that the research is done by a licensed physician. That sounds so basic, right? But if a doctor has lost their license, it's probably not a good idea to have them consulting you on any topic related to healthcare. And so I don't know long ago who all of the resources that I found that prevent that then in Jersey, it's a little different, but I was able to then not vaccinate my kids. Now, at the end of the day, I then swung back because I did start reading about the horrors of not vaccinating your children. My kids were getting older. I realized how unsafe it was, and that their dad and I just felt better vaccinating them, especially as they went into communal living situations like college, where there's a whole bunch of diseases. But my point here is make sure you're getting credible information. Talk to your pediatricians about what you're doing. And don't just talk to a pediatrician who's going to tell you what you want to hear, right? I've learned that's wisdom, right? From the old lady. You want people who are going to tell you what you need to hear, not what you want to hear. And so what you want to hear is going to be located in these groups where you can get all behind them and, burn pitchforks and, storming castles, when at the end of the day you want to go to really credible science. And I think one of the things that we've worked hard on at BCHIP is to share credible resources. You talk about the CDC, we talk about
CHOP.
even the Pediatric Association, CHOP, right? Phenomenal resource. If you want your kid to have brain surgery or your kid has cancer, you're going to go to CHOP. So these are people that you can really trust with this kind of stuff. So why wouldn't you trust them with vaccines if you would trust them with other serious medical health issues? So I just thought that that would be, good for our listeners to hear that it's okay to question if you question the right type of credible information.
I
So
couldn't agree more.
yeah, and to now have clinics available where kids can, and how many issues in life do we have barriers with?
Mm.
So it's phenomenal that you guys are securing funding and going after, people the giving people the ability then to get vaccinated, because there can be barriers. And there are also, there's a clinic in Doylestown where people can go. There's lots of, you can call BCHIP if you're homebound,
Mhm.
lots of different avenues. So thanks for doing all that work, because I know it adds work to you and your team.
Oh, thank you. But it's good work and it's appreciated work. I know the people that we serve are very grateful for it. And, it's for a population that really needs it, that should be served. So
Right.
we're happy to do that work.
Okay. Well, good stuff then. First of all, BCHIP's got funding. There's good data to suggest that really talk to your healthcare provider about vaccinating your kids. And if you can't afford it, there's going to be clinics in our schools in Bucks County. So that's all good stuff there.
Very good. Thank you, Dr. Gardella. Appreciate your time today.
See you next time.